Very good morning, my dear students. Today we are going to learn about a SISI test, that means a short increment sensitive index. The name is called SISI. So here the short increment sensitivity index, that is called SISI test. So here the patient with the cochlear lesion distinguish smaller changes in the intensity of pure tone better to that normal person, and those with the conductive or retrocochlear pathology. In this test, a continuous tone is present 20 dB above the threshold and sustained for 2 minutes. For every 5 seconds, the tone is increased by 1 dB and 20 such that the blinks are present. The patient indicates the blinks heard, that is they are collecting the SISI score for chronicle loss, that is hearing loss, that is CHL, chronic hearing loss. It will be shown 15%, and cochlear deafness will be detected 70 to 100%. The nerve deafness will be measured 0 to 20%. So here the SISI test is still widely used to determine whether the patient is having cochlear pathology. This test is based on phenomena known as a recruitment abnormal loudness growth. It was Dix and Hallpike who related the presence of loudness recruitment to the cochlear pathology. In this test, a pure tone was presented to the patients at the sound level of 20 dB. A small increases in the intensity is superimposed upon the steady state tone at periodic intervals. The size of the increment varied from 5 to 1 dB. The judge clearly demonstrated that the ability to detect the 1 dB increment was restricted to the patient with the cochlear pathology. This ability was absent in the patient with the normal hearing or with the conductive hearing loss. This test is very simple and to perform. So here the description of SISI. SISI is designed to test the ability to recognize 1 dB increases in the intensity during a series of bursts of pure tones present at 20 dB above the pure tone threshold for the test frequency. It can be used to differentiate between the cochlear and retinocochlear disorders, as the patient with a cochlear disorder will be able to perceive cochlear disorders, and this cochlear disorder will be able to perceive the increment of 1 dB, whereas the patient with the retrocochlear disorder will not increase. The requirement for SISI test items: first one is headphones or insert phones, second one is a response button. So this is the test procedure you are seeing here. That is dB is given in a white color and frequency is given. So that is here they have been taken different types of hearing loss and with respect to loudness and intensity level. Now the procedure for the test procedure. So what are the test procedure? You are going to learn it. First you press and hold the test button and select SISI short incremented sensitivity index using the scroll wheel on the audiometer. Second step, select the tone or variable in channel. If the cross hearing is suspected, masking should be presented in the channel 2. Third step, select the desired least frequency and set the input level of 20 dB above the threshold using the scroll wheel on the audiometer. Fourth step is the most common type of SASI test. The increment steps are set up to 1 dB by pressing and holding the function button AM, and it is possible to change the increment. The prior to present the actual test of 1 dB increments, a trial of 2 or 5 dB steps can be employed to ensure that the patient understands the test procedure and what will be the required. If you are certain about the response from the patients, the 0 dB can be used. You are seeing in the that is observation on a diagram below that. Next, step 5, explain to patient that they will not hear a series of tones. If suddenly there is a changes in the loudness of a presentation of tone, the response button should be pushed. See, step 6, start the test by pressing. The icon is given below that. The system will automatically count the number of reaction from the patients. And note that the system needs 20 presentation to the calculate a SASI score. Step 7, repeat the test for all the desired test frequencies. Step 8, press to icon given here. End the test. Step 9, save the SASI test by clicking the save session. So here the SASI result, the result should be conducted at 20 dB SL, sinusoidal neural losses, that is SL, for all frequency tested. If this patient does not manage to get the high score on the SASI test, this could be indicative of a retrocochlear damage. So here SASI test variant, what are the variant? Here there are 5 different variants of SASI test. First one is 1 dB increment at 20 dB sound level, that is called a classical SASI. The high score suggested a cochlear lesion, and at 2 to 5 dB increment at 20 dB sound. A low score suggested a retrocochlear lesion, and third one 1 dB increment at high sound level, that is about 75 dB, which provides a low score suggestion a retrocochlear lesion. Fourth one, increment sizes varied from 1 to 5 dB at 20 dB sound level. The poor score in 1 year than the other, that is when their threshold are approximately equal, which suggests as central lesion opposite the ear with the lowest score. So another fifth one, 1 dB increment at sound level ranging from 20 dB to high level about 75 dB in 10 dB steps for both ears. The difference in rate at which scores increases the suggestion retrocochlear lesion. This disorder is located on the same side of the as the ear, which has not shown normal increases in the intensity. So thank you for listening patiently. We will see it in the next class. Thank you very much.